Perfect. Great. Hey, thank you for joining today. I appreciate it. My name is James Mansfield, and excited to share a topic, a challenging topic, but an approach where we develop some algorithms to utilize machine learning, artificial intelligence to help vaccinate 200 million, yes, 200 million un or under vaccinated children around the globe. So certainly a key challenge for today. So our agenda that we have is first, we're going to review and discuss how AI tools can identify the un or under vaccinated children in the countries, both from the subnational and within geographic regions. Walk through kind of quick introduction of myself, spend a little bit about the problem statement around 200 million, discuss kind of what's recommended, right, for vaccination. So we're kind of have a foundation. And then the call to action, right, how we can utilize these tools to help address kind of these challenges. Then talk about the services that we have for Analytics for Living, and then see if there's any questions. That's great. Okay, first up, disclosure. The views of this are sole views of myself and not any prior company or client as well. So just wanted to share that quick disclosures before we get started. Okay, so I'm James Mansfield. I have responsibility for founding Analytics for Living, where we apply machine learning and AI to improve health, innovation around technology growth, and financial sustainability. Also a lead consultant with Data Prime AI, and I'll talk about them in a second. For me, my background, 25 years in life science, then consumer packaged goods, financial services, most recently coming out of Merck and GSK. So I have extensive vaccine experience too as well. So it was certainly in the space of working there. And then Tyler Roth, from Data Prime is one of the representatives there from Data Prime. Data Prime provides kind of talent. So certainly if we have the solutions around AI machine learning, but now you need to run this, where do you find the talent? That's why we've partnered with Data Prime to help us provide that talent acquisition. So they have many years of experience across Amazon, Comcast, and also the US government. So Tyler Roth will probably jump in, and feel free if there's any follow-up questions there. So when we get started. Okay, so why we picked this topic, and it's definitely a passionate topic for myself, is that currently there's about 228 million individuals, mostly children, at risk for diseases such as, diseases that you may not have heard of kind of affecting. So measles, yellow fever, polio, right? There's these 228 million currently. So why that is why it's mostly children is the under vaccinated. I'm going to go left to right. In terms of the programs, left to right. So in 2019, it's mainly due to COVID, right? That's kind of why. Sorry, I should say that. There's this pandemic that occurred that called this. So typically you would see, in 2019, roughly about 20 million children that are either un or under vaccinated, right? And that could be for a variety of different reasons, right? As you see here, but you'd see vaccine programs disrupted. Typically sometimes you'd see about 15% of vaccine programs in a country disrupted. Roughly about 15% of countries. And UNICEF, who delivers primarily these children's vaccine, typically sends out about 2.29 billion. That's almost 2.3 billion vaccines, they send, but still there's 20 million children that aren't vaccinated. Well, then COVID comes around, right? So I've watched this closely, and in 2020, 80 million, right? So that number, almost 4 times went to 80 million children unvaccinated. And primarily it's because 53 to 75% of those vaccine programs were disrupted. Those affected countries, were roughly about 114 countries that were affected. But if you think of just like, let's just pull out one vaccine, right? MMR, measles, mumps, and rubella, right? Everyone should have that, or every child should have that, right? That's mainly 27 countries that were affected. And instead of sending 2.29 billion, only 2 billion vaccines. So right now there's 280 million vaccines not shipped, right, in a warehouse there. So certainly a significant problem. Now we fast forward here to 2021. The data is from April was the study, so May timeframe, right? It's probably higher than that given what's happened around COVID, but it's roughly the under vaccinated is 200 million children, and the under vaccinated is anywhere from 220 to 280 million, right? So it's significantly dropped. If we compare that to 2019, it's 10 times, right? 10 times plus, 10, 11, 12 times what it was back in 2019. And that's still, we have this cumulative effect where you have 50 to 75% disrupted programs, and then 37 to 50%, 50 countries. 50% of those countries are in Africa. So significant problem growing. Where AI and machine learning fit is, it's great because there's a lot of data, right, that's available. Certainly we can do it collaboratively, but in the data that I pulled, it was the publicly available data that we did this analysis for. So let's step back and found everyone on kind of what, the basis are. So I just see a chat here. Vaccination control level. Okay, so where's the data you said? I think so the data in this case, and I can follow up with some links after the call if you'd like us to discuss or get on a line. But the data is publicly available from the World Health Organization, Gavi, and a few other sources. They have a database. However, what's definitely needed in addition to that is some of the shipments and supply chain that's there that we can partner with you to do. But the syndicated offering that we offer kind of takes the data and puts it in a visualization for you that I'll share in a second here as well. Because you want to see where those shipments are and then predict kind of the next, right? Where would you want to implement a program? But I'll share the link right afterwards as well. And thank you for noting. I'll put a source at the bottom. I have it in the appendix, but I'll make sure it's on the bottom in case that question comes up again. So let's found everyone, what are the recommendations or immunizations for children? So this is roughly about the 20 or so vaccines that are recommended for children based on World Health Organization. So, I talked about MMR, right? Measles, mumps, rubella, even varicella, right? Not all countries use that, but polio, Hep B. And then if you get more specific, like Japanese encephalitis and others, cholera, all these are recommended for children. And this is kind of what we're saying is of the 280 million vaccines that haven't shipped, that's roughly about 200 million children that have received these, right? So, certainly challenged due to COVID. I know we're, very focused and it's exciting we have a vaccine for COVID, yet, there's a lot of other, children that, are certainly a challenge here. So what does it prevent, right? What's the benefit of pre-COVID vaccinations, right? So pre-COVID vaccinations for children, this isn't COVID vaccination, it's vaccinations just in general, prevents 4 to 5 million deaths per year, right? Which is great. And the worst case, the scary part is if that's 10 times that you can't, right? That these children can't get vaccinated, well, it may not be, 5 million deaths per year, maybe, many more, right? I don't even want to quote the number, but, that's not something I want to model, but it's certainly scary. So, and the reasons come back is that the vaccination programs were significantly suspended or canceled. It's causing kind of children more risk for developing preventable diseases 10 times, right? And I said there's 280 million less vaccines, 228 million are mostly children are under vaccinated, 200 million children. So definitely significant. These are just pictorials of, different countries from Africa, from some of the European countries, Latin America, the bottom left, and then here, I think this Asia, I think as well, that I have, for children. But this is what we're talking about, right? The smiles the children want to see that, they should have their vaccines, but unfortunately, it's not the case. So where, right? So if I'm going to go left to right here. So in 2019, roughly, this was the view, right? So I grabbed the data, I ran the analytics and said, okay, here's the regions or the countries that have, and it's roughly about, 60% of these countries, 60% of those vaccines that did not get to the 20 million, we're in these about 10, 12 countries here. If we fast forward now to the right, use the similar data, it's regional now, right? It's a regional impact, right? You have pretty much all of Africa, okay, all of Latin America, including Mexico, most of the Caribbean, and then a few pockets here in Asia, right? Definitely significant, challenge that's happening where we go from kind of a handful of countries to kind of a whole region, a continent, right? So now you have a continent that may not have MMR, so forth, right? Very scary. And something that's definitely, I think, could be addressed using machine learning. That's what we're proposing today as well. So, and just to kind of, who delivers vaccines, because I think that's important to understand. It's not always a country. They may have the funding, but UNICEF typically delivers about 2 billion vaccines in 2020, but only 229 or 2 billion here in 2020. Versus typically about 229. So that's where, some of those numbers are, and the country data is available. So that's what I use to kind of do this analytics and put it on kind of like a visualization as well. But this is kind of the visualization that we're offering. We can take that data and provide that out. So then you could say, here's the region, let's look at the country. The action comes, which I'll get into, is, okay, now if you want to implement a vaccine program, where can it happen? Where's the COVID rates? Which we have analytics for, right? What is that trend going to be in the next 30 or 60 days? We use, profit model to predict that, to see kind of where that is occurring as well, because I think it's a factor in terms of if you want to restart a vaccine program, you want to know what's happening, in that marketplace as well. So how we do this, the approach, and this proposed approach, is that the data exists, it's robust, and it enables the development of features, right? And I call these kind of features left to right. So the data, and I think you asked of where, right? So the vaccine data here is program status is typically posted around WHO or UNICEF. Sometimes a little spotty depending on what's going on in the country, but it is valid, right? It's a good input. The World Health Organization, UNICEF, Gavi, and the countries all provide that data. It's public. You can download that. And I'll talk about the next supply chain, which is a little bit more tricky to get, but typically we would work with the country, and UNICEF to see where it was shipped if you wanted to ship in the future. But this is kind of the key, I think, the vaccine data that drives those numbers. The next would be patients. Like, so let's say if there was an idea, if it's MMR, well, now we can drill into country or region, country, and then the vaccine, right? And there's other data as well that's available besides just the vaccine data, that the records, the electronic medical records, surveys, health system, and then government data does publish as well. What's key, I think, is kind of the vision of how do you want to impact it, right? That's what we're proposing is, do the base case to say, here's our target, here's our vaccine. Now, where can we implement it? And that's where supply chain data comes in. Typically, the data gets shipped either from the manufacturer directly to UNICEF warehouse, and they ship it out of the country, or sometimes, in some cases, it goes direct to the country. It depends. In some cases, and that's why it's important to understand not only about where we're going to implement it, but kind of where can it go? And sometimes there is a tender involved. UNICEF typically has the tenders, right, that they're fulfilled. So you may not have to deal with the country unless we're buying it directly. COVID's important too as well. So we've run a number of models to kind of build the COVID rates. And why that's important is, let's say that you pick, MMR in Nigeria and let's say a country in Asia or something, right? And you're saying, okay, well, what's COVID going to look like in 30 to 60 days? What restrictions are in place there, right? Can they actually stand up a vaccine clinic for kids, right? So that's important to understand. But and then why these four kind of pillars are important. That's where machine learning and AI comes in, because they all develop, we use all that algorithm to develop those features, and then we're able to predict and say, okay, here's where the top country would be, or here's the benefits you can have for this country versus other. Here's the children that can be impacted, right? Here's the children that can be impacted based on that case, based on those combinations. So that's kind of the steps that we have that we do this. Where to start, right? So our proposal is that we formed Analytics for Living. It's a foundation. So we do have this syndicated offering. It's on our website. You can license this data, and we put that on a visualization for clients to kind of look and then and help with the plan. And then, we can continue on that engagement to at least kind of drill down to see kind of where you would like to implement it, right? But, in terms of the approach that we take is kind of how to prioritize. Will be, let's look at the patient lives impacted, the countries and regions, as I shared, the specific vaccines, right? What's in the warehouse? Is it not going to expire, right? And when to ship it, is it available? And then set those KPIs so that you can make it happen, right? Because it will have to be some trade-offs depending on where COVID as well are happening, as well as with the variant. So these four go into our machine learning algorithm that enables us to kind of employ, to answer, those questions. And this is just another illustrative about a little bit of the problem statement, right? If we go left to right, the problem statement, as I said, why we think is important is 48 to 55% of vaccine programs are suspended. Right, it's 200 million children, right, and that it's when there were vaccines being used, there were 4 to 5 million lives that could be saved, right? I think the number of lives saved, or the lives impacted would be more than that, given the fact that many more children are not vaccinated, and the rate of infection of those diseases is quite high. So, and they're all preventable. So I think it's a good, opportunity. The data and analytics we typically use for this is the vaccine data, the patient supply chain, the COVID, and the features, right? That's kind of it, right? It's not many data sets. It is many data sets, but that's kind of, we have developed the system to do that, to develop the trends, develop new data, and then we can run the algorithm and say, okay, where's the target list? And the pictorial on the right, step one would be, let's look at the vaccine by country region, which is this illustrative here that we have in terms of region of everything, right? But there's a filter that you can drill down and say, okay, let's look at this vaccine within this country, and then let's look at the lives impacted. And then that's where the patient need comes in terms of, how many patients could be impacted. In terms of that approach. So our initiative, right, as we said, so is that our recommendation was to, offer these syndicated tools, which we have available, and the tool would output, we think that the WHO, UNICEF, Gavi, NGOs, governments, the Gates Foundation that funds as well, kind of all these components, it supports the immunization agenda, and it's one of our missions too, as well as a foundation. So we do support that for these, and we think it's a real good fit to align to offer these. You can start with the government, or we can start with some of these other organizations too as well. So that's some of the content. I'm going to jump right back into to finish. That was the quick recommendation that we had. And then a little bit about analytics for living. Like I said, we are, our vision is neonatal analytics for life. This is one of the areas that we work on. If you check out our website, analyticsforliving.org, we have other therapeutic areas all within healthcare that do support these things. This is the vaccines one, but we have another piece on COVID and mental health, Alzheimer's, multiple sclerosis, a variety of other things like PTSD as well. So, our mission is we feel that we can improve access to life-saving medications, through the use of analytics and improve those lives. And we have proprietary, and also open source kind of tools that we could share, through our, I look at held up my hand like a visualization on the phone to say, hey, here's where you can point and click to kind of see that data kind of summarized, and then go from there. And where Data Prime comes in, if your organization, your teams need staff to support those initiatives kind of post delivery or after delivery, that's where we work with Data Prime to kind of find talent for you using their AI platform to provide those solutions. Perfect. So so I'm gonna here's some of the references. I think on the back you asked what were those references. So UNICEF, right, has the immunization that's linked here. The World Health Organization and the Pulse survey are two great sources. And then the other 4, 5, 6 are other public data, but I think the first three are good, solid. I didn't put on the COVID link here. I think everyone, I think you should have access to that. Like John Hopkins is the best that we use, but we pull that data, we tweak it a bit, we make it look at active patients. So if you're going to ship vaccines, we really need to look at kind of active patients, predict active patients, active meaning sick, right, that are sick right now in the next 30 to 60 days. That's kind of the key that the modeling that we have, and that's all part of that solution that we have. So I'm going to pause here just to see, to thank you, and definitely ask you if you can, like, I guess, or follow our Analytics for Living page on LinkedIn, as well as on the website, where we'll post, some additional content, and then additionally, we can follow up and join some of the other series that we have throughout. So definitely appreciate that. So yeah, I see a question here. Let me see. So your question was, please share the data source. So I think I shared that. Does the vaccination data at the country level, does it include vaccination country level procurement? Yes. So the data that's there, but that's a little bit more tricky, and that's how I drew off an algorithm or process is we can get the data and extract it at the country level by vaccine, right? It's not easy, right? But it can be done. And it's a lot of data then, because you have 20 vaccines, right? There's 187 countries in the world roughly, right? But we're only focused here, on regions, but it's many, many countries, 100 or so countries. So, having that in the visualization tool with the analytics with COVID is very important. That's why we, feel that, we're really trying to lead in the space and kind of, have that moonshot idea with this to do that. So I hope that answered your question there. So I'm going to stop the recording because I think we're almost out of time, and then I'll stay on if there's any questions. But thank you very much. Again, I'm James Mansfield. Website's at the bottom, and from the LinkedIn, you can certainly reach out to me, either Analytics for Living or James Mansfield online too as well.